Good afternoon, everyone. Welcome to the Cork online launch of the Patients Deserve Better campaign for investment in specialist nurses in neurology services. My name is Mags Rogers from the Neurological Alliance of Ireland, the national umbrella of neurological charities. I'm delighted to be joined this morning by Dr. Brian Sweeney, consultant neurologist in Cork University Hospital, by Declan Groeger, a person living with multiple sclerosis, and Tony Wilkinson, a person living with Parkinson's disease. Before I introduce our first speaker, Dr. Brian Sweeney, I'm just going to present a few short slides introducing our Patients Deserve Better campaign. And I'd like to acknowledge the support of Roche in the rollout of this campaign. We're just fresh from our first launch, our first regional launch of the campaign in Limerick through the month of October. We're now moving to Cork for the entire month of November, kicking off from today, and we're delighted with the support that we've received, both for the people that have registered for the online launch this morning, and I know that a number of our elected representatives has joined us for the launch, and I'd like to welcome them and thank them for their support this morning. As this is a webinar format, I'd like people to feel free to use the chat function if they have any questions or comments. And once all of the speakers have spoken, I'll address their questions or comments to the relevant member of the panel. So I'll just start off with a few brief slides about the campaign. I'm just sharing my screen here. So today marks the launch of the Patients Deserve Better campaign in Cork. And you'll see the stark, I suppose, graphic there of the messaging of the campaign in Cork, which I'll go through in a few moments' time. Just to talk about the organisations supporting our Patients Deserve Better campaign for investment in neurology nurses, we have a wide representation across over 14 organisations joining us in calling for more investment in neurology nurses across Ireland. Just, I suppose, to set this in context, outpatient waiting lists for neurology, and I know Dr. Sweeney will probably speak on this in a few moments, they're steadily increasing. As we speak, our latest figures are that there are nearly 24,000 people waiting for an outpatient appointment in neurology services. And while neurologists are critical to that, to reducing those waiting lists, nurses also play a leading role in reducing waiting lists and in keeping people off waiting lists, as well as keeping people well with a neurological condition, which I'll talk to briefly in the next slide. So neurology nurses perform a variety of roles, as you can see in this graphic on the right, from clinical roles within the hospital, evidence-based practice, providing advice, support, information to people with neurological conditions. Also a very important educational role with other members of the multidisciplinary team. And we have evidence, which Tony is going to speak about as well, from the Parkinson's Association in the UK, of just how valuable nurses are, specialist nurses are, in terms of cost saving, in making neurology services and health services in general more efficient, in keeping people out of hospitals. So there's very important evidence, and if you check out the website for the campaign, www.patientsdeservebetter.ie, you'll see a number of reference sources for the importance of neurology nurses, not only to the patient themselves, but to neurology services and the wider health service in general. There is a national shortage of neurology nurses. Our campaign is calling for 100 neurology nurses to address the shortfall. A survey that the NAI carried out towards the latter end of last year in 2020 showed a shortage of neurology nurses across every neurology centre in the country. The shortage is particularly critical in centres outside Dublin. We've just come from Limerick, where there's a significant shortage of neurology nurses. And Dr. Sweeney will talk as well about the shortage of neurology nurses in the Cork service, which, despite being the national neuroscience centre, the second national neuroscience centre for Ireland, is very underserved when it comes to neurology nurses. Just in terms of some information, many neurology patients in Ireland have no access to a specialist nurse, and recent mapping of Parkinson's services, again, which Tony will talk about, shows that 80% of people with Parkinson's disease, for example, do not have access to a clinical nurse specialist. So Cork in Focus, and I'm going to speak briefly because I'm aware that there are people much more expert on the Cork situation to follow me this morning. But just to reiterate, Cork is the National Neuroscience Centre in Ireland with 4 neurology nurses and a shortfall of 16. What does this mean in practice? This means a very high workload for the existing nurses that are in place. It means there is no dedicated nurse at the moment for conditions like migraine and Parkinson's disease. So overall, despite being the National Neuroscience Centre, Cork University Hospital is particularly underserved when it comes to neurology nursing, and there is a significant shortfall in place. I'm going to stop speaking now and turn to our other speakers who will give a much more nuanced perspective on the situation in Cork University Hospital and the needs in the region. But I would just invite people to visit the website, patientsdeservebetter.ie. The whole focus of this campaign is to invite people to visit the website, to contact their local TDs, and to make them aware of the situation and call for their support. And the whole website is set up so it makes it very, very easy for people to find their local TD details and contact them. And I would urge people following on from the meeting this morning to follow the campaign on social media at #PatientsDeserveBetter, and also to visit the website www.patientsdeservebetter.ie. So thank you. As I say, that's just a whistle-stop tour through the campaign. And I'm going to turn to my speakers this morning to give a much more detailed picture of the situation in Cork. I'm going to turn to Dr. Brian Sweeney, consultant neurologist in Cork University Hospital. And he's going to talk a bit more about the neurology service in CUH, and in particular, the impact of the understaffing in clinical nurse specialists in neurology. So Dr. Sweeney, if you want to start.
Yes, thank you very much, Mags, and thanks to Tony and Declan for being part of this today as well, and giving up their time to come and speak from the user's perspective, or the people who use the service. I'd like to thank the NAI for highlighting the issue around the shortage of nurse specialists. And I'm going to give an overview of the Cork site. It may be a little bit CUH centric because we're the main neurology centre in the region, and it gives you some idea of what we do and the potential shortfalls. Sorry, now it's just slow to state change. Sorry, now. So in our there is a strategy which was developed over a number of years and finally published in 2016, which is a strategy which is to try to develop a proper neurology service for our population, which is I think just gone over 5 million in the last year, and we know that about 800,000 people have a neurological condition in this country. Neurological illnesses count for about 10% plus of visits to the emergency department and about 20% of visits to GPs. And this report gave recommendations which were to particularly around staffing and resourcing, and very key with regard to the number of nurses. What are the illnesses we deal with? And we have people representing illnesses and other illnesses which may not be on this list who will be taking part in this seminar today. The most common disorder is headache, then epilepsy, stroke, multiple sclerosis, Parkinson's disease and Parkinsonism, dementia, neuropathies, for example, like carpal tunnel syndrome, motor neuron disease, myasthenia gravis, and functional neurological disorder. And there are, in the International Classification of Diseases, this is the different subsets of disorders of the nervous system, which go across a range of different parts of the neurological spectrum. And the other point to make is that neurological complications can occur in systemic diseases. So in conditions like diabetes, people can get neuropathy or be at increased risk of stroke. In people with systemic lupus, they can have stroke or myelitis or cognitive problems. In people with cancer, you can have seizures or what are called paraneoplastic syndromes or drug side effects, which can affect the nervous system. And then pregnancy, which we have a large maternity hospital on our site, neurological complications in pregnancy. And then the other area is in support for medical assessment units, which is where people would present for acute medical assessment, as I say, maybe over 10% of presentations to emergency departments. Another big area of that's important for people to be aware about neurology is that the nervous system is really undergoing a revolution at the moment, and you're seeing major innovation and complexity. So in areas like the new CGRP drugs for migraine and headache, the recent licensing in the States of aducanumab for Alzheimer's disease, the use of immunomodulators and bone marrow transplant for MS, and things like deep brain stimulation surgery for epilepsy or surgery for epilepsy or surgery for Parkinson's disease, for example. There's a hope that we will get Parkinson's disease surgery going in the island in the next 12 months or so, or in the Republic. We have the impact of areas like genetics, which affects diagnostics, but also have impact on families in what we call a cascade effect, where if you diagnose a genetic disorder, that has implications for other members of the extended family, which requires a lot of counseling and time. Innovations in stroke, like stroke thrombectomy, imaging of the brain with MRI and PET scans and other types of sophisticated imaging that are coming in. Ethical dilemmas around provision of care, resources, how those resources should be allocated, end-of-life issues, the impact of economics. So what about the cost of these interventions? For example, aducanumab for Alzheimer's disease is going to cost around $60,000 a year in the States. So who should get it? How should it be monitored? When should we withdraw? So difficult. And then a very important aspect of neurology, which Tony and Declan will allude to, is that these are illnesses that people live over many years and decades. So they're often lifelong. CUH, the department was founded in 1970 in St. Finbarr's Hospital and then moved over to CUH in 1978. There's always been a smaller unit at the Mercy Hospital. It's one of 2 national neuroscience centres and one of the 2 centres in Ireland where you can have thrombectomy for stroke. And there are many departments, and this gives some idea of the complexity. Again, neurology, neurosurgery, pediatric neurology, neurophysiology, neuroradiology, neuropathology, rehabilitation medicine. So these are all people who contribute, and we need support from other departments as well, such as in liaison psychiatry, urology, GI medicine, and we are a 24/7 call and tertiary referral centre for Munster. So there's always neurologists on call, and every single day of the year, doing rounds and so on for acute emergencies that arise in patients in the population. In terms of the different neurologists, and this is again based around CUH, there are 2 neurologists who work in the bonds as well, but these are just the different people who all have different specializations. We've just had 2 further consultants post-approved, which is great after a lot of hard work on a lot of people's part, and we're hoping again that actually that clearance has been made now, and those posts will be advertised soon. And then we have a headache clinic run by my colleague, Dr. Eddie O'Sullivan, with my help. And then we have pediatric neurology, Olivia Manny and Neil Sweeney. So this is just around the neurologists. These are our interface. I'm not referring to neurosurgery here. And as Mags has said, we really need a multidisciplinary team. So, and really focusing on neurology, we have epilepsy and MS nurses, and then we have 2 stroke nurses, but this is far too few, and really it needs to be vastly increased up to at least 20, as Mags has said. The reason being that we can end up developing good services for patients which are patient focused and which are maybe based around a particular area where a nurse specialist can take an interest in, say, Parkinson's disease and really concentrate on that area full time. And also a nurse specialist will remain in post over time, whereas sometimes our junior doctors will change and move on after the 12 months. So they may be excellent, but they're not there always. So this allows us to develop allied specialists to ourselves. So I think that's very important. We have, areas in physiotherapy. We have a particular lack of neuropsychology. So that's something we're really trying to work on at the moment. I'm glad to say that the Parkinson's disease nurse has finally been approved and hopefully will be interviewed for in the next few weeks. And one particular area that's important for me is around chronic disease management. So what I mean by that is, let's give the example of MS. What if we had, say, we have nearly 2,000 people attending CUH with MS, and we have basically 1.5 clinical nurse specialists to look after that workload. So it's really totally inadequate. And in the UK, what the ratio is 1 nurse for every 350 patients. And that allows that person then to have those people on their books. And let's say they haven't heard from somebody for a while, they can reach out and say, what's going on? How are you? How are you keeping? What if somebody's doing quite well and doesn't need to come back to that clinic visit, but we'll be happy to defer it for another month. Maybe that visit will be given to somebody else. The other area that's really important is around monitoring of treatment and monitoring of side effects. So that's hugely important as well. And so that's why that's so important. And that, again, can be taken on by nurse specialists and taken away from the neurologists who are already overstretched. So really vital. The other point to make is that it's not just about the clinical workload, which obviously is most important, but there are many other roles that are taken part by students. So undergraduate teaching for medical students and nursing and other students in UCC. We are doing basic specialist training of the interns and SHOs. So these doctors may not become neurologists, but they may come across patients with neurological illness in their practice, and they need to have some skills in that area. And then in those who are interested, we're a national specialist training centre for neurologists of the future. So we really have to be aware that we need to have a stream of brilliant people coming through. I'm glad to say, as one of the national specialty directors, that we have fantastic people coming through, but perhaps not enough. And we're trying to increase the numbers so that we will have enough to, when new jobs are created and when people are retiring and so on, that there will be the neurologists there who are both trained, but also wanting to come back to Ireland. And then another area is in research. So this is just some example of some of the papers in research that have been published in the department in the last 12 months in areas like stroke, epilepsy, and in pediatrics. So we have a governance structure, but we don't necessarily have things like control of budget. And there is a national program for neurology, which is currently being run by Professor Orla Harriman. In our department, we do a huge amount of work. We have an inpatient service for acute neurology. And we did an estimate recently that about 20% of the acute medical beds in the hospital were with neurology patients. Inpatient consultation service to other medical and surgical departments. An outpatient service for general and specialist clinics, so general and specialist areas in things like epilepsy, for seizures, TIA, MS, motor neuron disease, Parkinson's disease, and as I've already iterated, the diseases are often lifelong. A particular area for us that's important at the moment and would be vital for our nurse specialists is that we need better OPD resources. Our OPD situation has been very badly affected by COVID response. So our old outpatients in the hospital has been taken over as part of the COVID response, and we haven't got it back. At the moment, we're operating on a small number of rooms in a site just outside the main hospital campus, but that is not a permanent solution. And we really, it's just barely enough space for our neurologists and our registrar, but not enough space for our other allied healthcare professionals like nurse specialists or physiotherapists or OT, where we could have a real clinic where people could see several different specialists at once in the one clinic visit. So that's really important to us and a really important issue that we'd like to highlight at this meeting today. So really, I can only highlight what Mags has said, that it's so important for us to get more nurse specialists, but basically we need more of everything. I just had a picture the other day of a centre for multiple sclerosis in Canada, a 45 million euro building in Toronto, just unbelievably well staffed, well resourced, and that's just for MS alone. And they were saying that, in Canada we have a high level of MS, so this building is so necessary. But actually, hold it, guys, we have a huge incidence of MS in Ireland as well, but we could only dream of that kind of resource at the moment. So it's really, really vital. I don't want to be negative, and I do want to say that we are going forward, and there are many very positive things, but I think we really need to up our game. And my pride is for Cork and for the area. It's as good as anywhere in the world. It shouldn't be kowtowing to anybody else. We should be aiming for the best. And that's what we would do in all aspects of our lives and in our pride. So it's really important. Clearly, there are certain services that in a small country can't be developed everywhere. And we fully acknowledge that, and we will work with the people. So, for example, if we get a bone marrow transplant centre or a deep brain stimulation specialisation for Parkinson's, that will probably be based in Beaumont. But we can certainly work with that group, and we're very much actively involved in helping and supporting, and then following up patients in our local area once the surgery is done or whatever, or the procedure is done. So really, that's all I have to say. Thank you.
Thank you, Dr. Sweeney. And I suppose we're on the same message. The National Advocacy Group and the local service in Cork University Hospital is saying the same message in terms of clinical nurse specialists, that there is a disproportion between the demands on the service, the growth of the service, what it's trying to do, and the understaffing. And I know you've said the understaffing is across the service. It's a question not only of staffing but also of infrastructure. But I suppose just in terms of today's messaging for the purpose of this campaign, the call is there is a critical need to increase the number of nurse specialists in Cork University Hospital. And
yes, I've always said that we don't want any more than anybody else. We just want a fair crack of the whip. And people with neurological illnesses, it's the most, as far as I'm concerned, the brain is the most important organ in the body. And, we need to care for our brain, and we need to look after that aspect, especially our general health is improving. We're living longer lives, which is fantastic. But the nervous system, in that context with areas, for example, we know that dementia now has become the most common cause of death in women in the UK. We need to work on the brain and the nervous system, and we need to, it's such an important organ, and yet sometimes it doesn't get the full resourcing it needs, in my opinion. But I'm not asking for more or any, it's just about getting an equal share of what's out there. And we would like to see maybe some improvements that have come in areas like the cancer service, that they would come across to us as well. And I think plant is particularly important, like clinics, proper buildings and spaces for the work to be done. I think that's so important.
Exactly, and this is the demand of which is only going to grow. And just for the elected representatives in the audience this morning, Dr. Sweeney, just to point out, pick you up on a point. I suppose somebody looking from outside the service, maybe not with the awareness of the service, looks at it and says, "Oh, there's 1.5 CNSs in clinical nurse specialists in multiple sclerosis. Sure, that's fine. Sure, look, that area is covered off." But just to pick you up on your point, that's completely out of proportion to the caseload they're carrying. So while there are both there and there is a nurse there, it's unsustainable.
Yeah, you see, I think one of the things for me as well is that some people are very good at negotiating the system and know how it works and can get the care they need, and they don't give up, and they know how to get around the nooks and the corners and the blocks. But there are people out there who might be quietly, struggling and maybe not being able to get help or get support. And one of the things for me is, in our system, if you don't call, we are so busy, we don't necessarily say, "I haven't seen Mr. Smith for 6 months, I wonder how he's doing," because it's just based on demand always, and the patient has to reach out to us. Whereas I think that if you have a proper system with a proper registry of patients and a proper, with nurses who are there, and if they have, say, an Excel spreadsheet and they say, "Oh gosh, we haven't seen Jim for 6 months, I wonder how he's doing," or, he hasn't been in touch, maybe that's the person that we need to reach out to. And also, maybe somebody else could be doing really well, doesn't need that clinic visit on that particular day, could, maybe just needs a call and is doing well otherwise. And that clinic visit could then be given to somebody else who might need it more. So it's just about managing these resources, in a very efficient way. And I noticed that on the questions, somebody's asked about HD, and we are very much involved with, understanding what the needs of people with HD are, and also how we might be able to co-work with Beaumont, because I know they're doing some research projects at the moment. I'm sorry, the numbers, the conditions that I mentioned were just some of the more common conditions in the list. They weren't necessarily comprehensive across the whole range of neurological conditions.
And I suppose in the context of our national campaign, there is no clinical nurse specialist in the entire country at the moment for people with Huntington's disease.
Yeah.
So you're not in terms of struggling to meet that need. Dr. Sweeney, thank you so much for your contribution and for giving that insight into the services in Cork University Hospital.
Okay, thank you.
I call on Declan Groeger to speak. I suppose we can speak to numbers and the lack of staffing, but the two patient representatives that we're lucky enough to have here this morning are going to talk about what it's like, I suppose, having the services of a clinical nurse specialist in Declan's case and having that number to call on. And then in Tony's case, where there is still that gap in terms of the needs of people with Parkinson's disease for clinical nurse specialists in Cork. So Declan, if I could turn to yourself.
Hi everyone. Yeah, my name is Declan Groeger, and I have been living with multiple sclerosis for 33 plus years. When I was diagnosed, back then there wasn't even an MRI scanner in Cork, not to mention neurology nurses. And I find it incomprehensible at the minute that, and I actually didn't know the numbers until Dr. Sweeney started talking this morning about the numbers that should be there, but I knew that I have access to 2 neurology nurses in Cork University Hospital, and for that I'm truly grateful. But I didn't know that those 2, Ethna and Shinto, covered every neurological disease other than epilepsy and stroke. They have an absolutely massive caseload to carry. I don't particularly, I rarely get onto the neurology team, but for me, the fact that I know that they're there, should I need them, is of absolutely vital importance. And I find it incomprehensible just that some places like Limerick or other parts of the country don't have access to a neurology nurse. It just absolutely beggars belief. And I know that we don't have enough neurologists in the country. So again, before this morning, I knew if we don't have enough neurology specialists in the country, we certainly don't have enough neurology nurses in the country. And something has to be done to make life easier for us, and I'm saying us people who are living with incurable diseases. It's just, as I said, it's just not understandable in any way, shape, or form. I think that I'm so lucky that I can ring Eileen, or I can email Eileen and say, listen, I have a problem, and I know that she will be back to me within a short period of time, because she knows that this is probably the wrong word to use, but she knows I'm not a high maintenance patient, that I won't ring or call unless I really need to call. She knows that when I do make contact, that I'm in need of something serious. So just knowing that they're there, a bit like the song goes, just knowing that the door is always open. It's just knowing that is such a huge degree of comfort for me and for my family, to know that they can ring, they can ring if I'm not able, and thankfully that has never happened. But it just beggars belief that there's only 2 neurology specialists in Cork that cover the whole, in Cork University, that covered the entire gamut of neurological diseases other than, as I said, stroke and epilepsy. And look, I'm grateful for what we have. I know that the powers that be, and if there's politicians or anybody from the HSE listening to this or going to watch it afterwards, that listen, that you need to do something to make life easy. We didn't choose this disease. And I know certainly Tony didn't choose his. Our families didn't choose it, but they've stuck by us. And you need to get, I was going to say, you need to get off the fence and get working to help us live fuller and just more enjoyable lives. You need to get off the fence. You need to do something, and you need to do it now. Thank you, Megs.
Thank you so much, Declan. And I know before today as well, I spoke to you about your own diagnosis years ago and the difference you felt it would have made having the nurse specialist that you could lift the phone to, trying to go to different places looking for information. And if you'd had that at the beginning.
Well, as I said, back in 1988, we didn't even have an MRI scanner in Cork, not mind saying, nurse. And the diagnosing doctor, and I'm not going to mention any names, but he had never been to PR school to actually sugarcoat the diagnosis. It certainly wasn't helpful the way that I received my diagnosis. To have had somebody, I don't think we even had Dr. Google online at that stage, but to have somebody that I could have rang up and said, listen guys, this is it, instead of being told, well, go away home, and if you have any questions, come back into me. It's just, things have changed. So there was no medications back in 1988. I didn't start medicating until 1998, I think, or 1999. So there was physically nothing there. But things have improved to have two neurology nurses that I could call on, even though they're overstretched and everything. But to have two that I can call on now at some stage, just to know that they're there now and that they're there for anybody who gets an MS or any neurological disease, who gets a diagnosis, that they will be able to talk to somebody and not just push buttons on the phone and start looking up Dr. Google. And whereas he's a very gifted doctor, some of the stuff may not be reliable.
Absolutely. And Declan, thank you so much for that insight this morning. I'm going to go to our final speaker now, Tony Wilkinson, person living with Parkinson's disease in Cork. And Tony's going to speak from the perspective, I suppose you've said, Declan, that the service is overstretched, but it's there. Tony's speaking this morning from the perspective of a service that isn't there. There isn't, I know we had the good news from Dr. Sweeney that they are hoping to advertise a post for Parkinson's nurse, but at the moment they don't have one in staff. And so, Tony, if I can pass to you now, of talking on behalf of the group that you represent as well, as the impact on people of not having that service in place, and your own experience in the UK in contrast to that.
Okay, thank you very much, Max. And thank you, Declan. Yes, I'm talking on behalf of Cork Parkinson's, and basically you can say I have two stories of Parkinson's. I was diagnosed in 2015 back in the UK, and within 2 weeks of being diagnosed, a Parkinson's nurse came to our house and met Kate and myself, and she was absolutely the right person at the right time. I was in denial, I was confused, I was lost, really. She came to the house and she basically, to use a military term, grabbed me by my bootstrings and pulled me up, spoke to me, understood me, and put me on a good path, a good way of thinking. And that person, Catherine was her name, I'm sure, she became my point of contact. And I was one of 300 because that is how many people she would look after. So one nurse, 300 people. And that's a manageable ratio. Not like Declan was saying earlier, where you have two nurses and they're swamped. Just anybody with a neurological problem, they get them. That's impossible load. That work case cannot work. So there she was. She gave great advice. She saw me at home and everything. I had her number. And even when I moved to Ireland for the first year I was here, she rang me a few times, see how I was getting on. That's how good having a Parkinson's nurse is. And they don't just see you now and again. You could see the nurse she sees you about 5 or 6 times during the year, because she might come to a coffee morning and she'll be just chatting to people and that, and she'll just observe what's going around. And the brilliant thing about it was that she was able to change medication. And that's a very, very important thing, because when we go from this visit to the consultant to our next visit, which could be 2 odd years, the change in medication is drastic. Whereas what having a Parkinson's nurse does is she keeps you going steadily along. And that is one of the qualities and the benefits of having a Parkinson's nurse, and what I got from it. Now, why is it that everywhere in Europe you go, France, Germany, Holland, Belgium, etc., they have these Parkinson's nurses, and yet over here, for the whole of our country, we have 6, I believe, in total for the whole of Ireland. Look across the border and they have 22. 22 Parkinson's nurses. Now that tells you a few things. One, across the border, they understand the true value of that nurse. They understand that that nurse keeps people away from the consultants so that consultants have better time. They can give a quality service, because at the moment, our consultants are under a tidal wave from all the neurological issues around. And because we don't have a specialist at the moment, that's not very good. I've been seeing someone whose job is a stroke specialist, and they're seeing me for Parkinson's. That's not fair on them, because they're having to do a job which is not their speciality. And really what you end up with is a group of neurologists who are jack of all trades and have not been allowed to specialize in that particular field that they want. Having a Parkinson's nurse, it frees up hospital beds. It keeps people out and stops bed blocking. And it has less illness, as I said, because they can do those changes with the medication and see you and see those minute changes in you. It stops those drastic swings, and it means that there isn't that amount of time between one change of medication and another. The better quality of life that that person gets from having that nurse. And when you're having a really bad time or something has happened, you ring that phone number, you give them a call. Oh, sorry, that's how it is nowadays, isn't it? You ring that number. That's old-fashioned. So these are all very, very important things. Now, one nurse in doing her job saves the HSE €300,000 per year. Every year she saves that money because she's keeping people out of hospital. She's keeping them in good health. So those facts and figures, as Mags knows, comes from the Parkinson's UK, which is a very, very good website for finding out all this type of information. When you want to drill down and find out information about Parkinson's costs and everything, go there. Believe me, that is the best site. And when you think, if we have in Cork 1,250 roughly Parkinson's people, that's 6 nurses. That's a saving of what, 1.2 million a year. Look at that. That is huge. Yeah, it's not actually taking money out of the pot. It's putting money back into that pot. And if we had 40 of those nurses in the whole of Ireland looking after Parkinson's people, that's a £12 million saving. Because across the border, those 22 nurses are saving £12.6 million to the NHS. Now look at that money that we could be saving, the HSE. And the issue that is here is it's the structure. And again, I mean, Dr. Sweeney can probably sort of give a little information on that type of thing. But a big thing a few years ago, everyone was talking about, I hope I get this right, Sláinte care in the community. That is huge. And that's what these nurses are, right in the community, right there with you. And again, that should be the same for Declan, that the nurse can come round to see him instead of traveling in. And this is where we can get huge benefits from this. And one of the things that I always sort of think is that if you do what you've always been doing, you'll always get what you've got. And that seems to be the situation at the moment, that we're not looking to find these nurses. What we're doing is saying, well, here's the system. This is what we've got. Let's think about it. We'll carry on doing that. That has got to change. And if you're a TD listening in, or a senator. Declan is right. We need that ground shift. We need that change, and that difference, that saving of money, that's what we're doing. We're actually trying to save you money. So I think I've covered basically everything there. I hope I've got a few points across. Max, thank you very much.
Thank you so much, Tony. And the research that you've done is very much appreciated. You have your facts and figures to hand of the personal experience, the difference that you had coming from the UK and not having that service in Ireland. Yeah. But also, as I said, the facts and figures, this is not just an add-on. This is something that is saving the health service money, that is keeping people out of hospital. And just to go back to Dr. Sweeney's point, we're not asking for more than any other centre has. We're asking for what every centre in every other country has. And I suppose the shortfall is so stark between the 4 neurology nurses that are in place and the 20 that are needed. And we have information on our website, www.patientsdeservebetter.ie, which backs up the ask. As I say, this is coming from the neurology model of care in Ireland, from the epilepsy model of care, and the figures that recommend that there should be at least 20 clinical nurse specialists in Cork University Hospital.
Yeah.
I would urge people to find out more about the campaign, to go onto our website, patientsdeservebetter.ie. I would urge the elected representatives that have joined us this morning to take action on this, to support this campaign, to submit parliamentary questions, to speak on the issue in Leinster House. We will be carrying this campaign all around the country. As I say, we'll be focusing in Cork for the whole month of November. So we're not going away from today. The whole month of November will be dedicated to campaigning in Cork. Then we'll be going to the other regional centres, and then with a national focus for a National Brain Awareness Week in March 2022. So we're absolutely not going away. We're building momentum as we go around the country with this campaign. We're delighted with the buy-in and the support that we've got from patients, families, patient organisations, and from the neurology services as well, because they're at the front line of dealing with these shortfalls. And we weren't able to be joined by one of the clinical nurse specialists from Cork this morning, but each of them that I've spoke to have highlighted just how overstretched and how busy they are in the service. And I'm sure Dr. Sweeney will echo that. So the takeaway message, I think, from this morning from all of our speakers is that neurology services are getting busier. We have the good news that more treatments are becoming available. There is more that we can do for neurological disease, but we are not serving the people with neurological conditions in Ireland the way that we should be. We're not providing the services that should be that are available in the entire rest of the developed world, but is not available to Irish people with neurological conditions. Ironically, we make some of the most advanced medications to treat neurological conditions here in Ireland, but the services that Irish people with neurological conditions receive are not on a par. Even though the care is as good as people can provide in an overstretched service, we are not providing the levels of service. We are not doing duty to both patients and the clinicians working in the service. Mm-hmm. So the take-home message from this morning for people is to get behind this campaign, visit patientsdeservebetter.ie, get in touch with your local TDs throughout the month of November, and call for action to increase the number of clinical nurse specialists for Cork University Hospital. I'd like to extend a very warm thanks to Dr. Sweeney, and to both Declan and Tony this morning for giving their talks, which I know that they prepared in advance. They were looking for information from me and compiling their research in advance. So I'd like to thank them for all of the work that they've put into their presentations, and to thank our audience this morning for joining us. Thank you.